Thank you so much. Really excited to introduce two panelists that are going to have a short video with us. That is Rosella Akawili, who is a social protection specialist at UNICEF, and Ruth Georgette, who is a social policy and program coordinator at FAO, and both of them are joining us from the Philippines. So maybe just to set a little bit of the scene. So in the Philippines, there's extensive reach of social protection systems. I think you guys would agree. It is also a country that is multi-hazard prone. And in addition to that, we've seen considerable use of cash and voucher assistance in humanitarian settings. But sometimes, in some contexts, we see that there are silos: social protection, humanitarian cash, and early action. I'd really like us to dig in a bit to this initiative that you guys have been working on, which is creating anticipatory actions and really leading to early action in the Philippines. So I'm going to turn to you first, Rosella, and ask you the first question. So what was the problem that you all were trying to solve?
Thank you, Holly, for having us here. We are looking for ways to effectively channel assistance to poor and vulnerable populations in a most efficient and effective way, in a manner that would allow us to reach more beneficiaries quickly and give assistance in a manner ahead of an emergency. Social protection programs potentially offer this opportunity because these programs have a ready infrastructure that one can use, such as social registries, beneficiary lists, payment mechanisms, communication channels to beneficiaries. One can link up to this by either vertically or horizontally expanding these programs as needed.
Interesting, yes, okay. So the Philippines is a special place from what I said at the beginning, right? So there were some enablers that really helped you to be able to think about this, helping you guys to ideate and to find a special sauce, should we say. So what was that special sauce that you guys were able to use to move towards this project?
Okay. Foremost is that there is an existing large-scale social assistance program in the Philippines, that is the Pantawid Pamilya Filipino program, which the UNICEF has been providing policy and operational support for more than a decade. The 4Ps is implemented by the Department of Social Welfare and Development. Our existing partnership with the SWD allows us to support their policy reforms and also introduce innovations such as this. We are piloting this under the Central Emergency Response Fund Anticipatory Action Pilot to link AA interventions to social protection ahead of the landfall of a major typhoon. The AA pilot has not been activated yet, as the triggers have not been met the previous years, but the pilot in itself remains active as a project. The idea that we can use this opportunity to look at ways of improving how we do emergency preparedness and response by linking this to social protection also helps reinforce building resilience among the poor and vulnerable populations. We use this opportunity as well to build the evidence, and I think that is one thing that makes it attractive, apart from the intention of providing assistance ahead and reducing the cost of emergency response.
Absolutely. Of course, we want to provide support to the most vulnerable people, but we also want to show how it can be done and how it can be done better. Maybe turning to you, Ruth, now, what are you still trying to answer in this project?
In terms of what we're trying to address in this project is really, as Zara said, the scaling up of a humanitarian response to very specific hazards. In the Philippines, we have typhoon, flood, and most recently drought. And having said that, we have not just amongst a list of who are the poor, but also it requires also identifying who are the most vulnerable. Vulnerable to these various hazards. And when we put together these two data sets, we should be able to identify who will be needing the most assistance using government social protection systems. And largely because we have very limited resources, we cannot be able to respond altogether to huge population, but really focus on who will be needing this based in terms of what Rosella was saying, of vertical expansion, topping up from an existing database of beneficiaries in a social assistance program, and horizontally looking also at those we know will be most affected, especially in anticipation rather from these various hazards.
Great. No, really important points there. So, this video is being recorded for folks that are mainly working in Latin America and the Caribbean, across the Americas. Also another hazard-prone area, multi-hazard prone, lots of social protection, and a growing use of humanitarian cash as well. So from your perspective, from the Philippines, Ruth, maybe taking from you, what would your advice be for actors in other regions who want to prioritize using early response, anticipatory action, where they're connecting social protection, humanitarian cash? What would be some of your points of advice for them?
Yeah, I think the first would be ownership. If we want to tap into social protection systems of existing governments, we need to first and foremost work with government to help them understand and appreciate this concept. In the Philippines, it's still a nascent new concept. It makes sense, but for them to be able to fully understand and own it requires really working with them on a regular basis, as well as explaining it. So ownership is important. They need to be in the driver's seat. Second is coordination. We recognize that in the Philippines, there are various actors, stakeholders who are implementing anticipatory action using cash as the first modality to be able to respond before a disaster. But having said that, you have these INGOs who have already been practicing this. And therefore, the need to be able to coordinate with them and learn from what they're already doing and bring it to government's information, government's conscience, so that they're able to pick up from these lessons and implement it themselves. We at the Food and Agriculture Organization are working closely with the Department of Social Welfare and Development because we recognize that they need to be in the driver's seat to own and lead the coordination within government and across the INGO humanitarian actors. And why is coordination important? Well, largely because we want to harmonize our work. We cannot have one INGO or a group of INGOs implementing cash modalities using a different cash transfer value versus government using a different cash transfer value. So in the context of identifying what those commonalities are is important and agreeing. So one would be the cash transfer values. Second would be potentially looking at post-distribution monitoring questions that can be consistent as far as learning across INGOs and the government. So these are just simple examples of how we need to really take stock of coordination work in the country across not just government, but also among INGOs. And the last is very, I think, to me, very important in terms of policy and program. If we were to scale up and institutionalize this work of anticipatory action using cash and other cash plus modalities, we need to be able to have both the policy environment, create that enabling environment for governments to take this forward. And you also have to have the programs. Piloting programs at a small scale is important to gather and capture those lessons and feed it back into the design. So this does not happen overnight. It requires really working closely with government, non-government organizations, the UN partners, but also being able to capture these lessons, bring it into a design that makes sense for government, and then revising it. And it really will require cooperation and time to come up with this mainstream pilot with government.
I love it. Policy programs, harmonizing ownership, and looking at the PDMs, looking at the transfers, lots to take into consideration. Rosella, do you want to get the last word on any advice you might have for folks in the region?
Yes, so I think as I've mentioned a while ago, let's always try to make sure that we build the evidence base around these pilots, no? Because at the end of the day, if you want government to own up and if you want government to scale this up, you always have to make sure that you also, while doing these pilots, build the evidence along the way, trying to capture the lessons learned, and also trying to understand what works and what doesn't work in a given context. Yeah.
Absolutely. So evidence is key, getting to know what works and doesn't. I love it. I want to thank you both so much for taking the time to talk with us today. And I think that you really brought some interesting points of view in a cross-regional event. And thank you so much for sharing.
Thank you very much, Holly.